Hi, my name is Chip, and I'm a paramedic instructor for the state of North Carolina. And I'm here today to talk a little bit about how to perform basic first aid for a person having a seizure. Hopefully we've called 911 as soon as we realized someone was having a seizure. However, what you can do while you're waiting for EMS professionals to arrive is a couple things. Number one, make sure the patient's not going to hurt themselves any further. If there's furniture around, chairs, tables, things like that, we can move those away from the patient, especially if it's a full body shaking type seizure activity. If you have something soft, such as a towel, a blanket, a coat, and while they're seizing, if you could gently put it under their head so their head's not hitting the ground too hard, again, that's going to help prevent any secondary injuries during the seizure activity. We need to make sure that we don't lift the head too high because we can close off the airway when we do that. Once the patient stops the actual seizure activity, we need to make sure the patient's breathing. Hopefully you've had a CPR class. If not, I would definitely recommend you go get certified in basic CPR. And once the seizure activity stops, you want to make sure the patient begins to breathe, because oftentimes when someone's seizing, they're not breathing at that time. But hopefully when the seizure ends, they will start breathing on their own. If they don't, we need to assist them by breathing for them, which is another topic altogether. What we're going to do is once they've stopped, we want to go and keep them warm, cover them up with a blanket or sheet, try to give them as much privacy as possible, especially if we're in a public area. Continue to monitor their breathing as we go. Again, wait for EMS. Verify that someone has called 911. And for seizure activity, if it starts again, we just want to make sure we back up and don't allow anyone to get in the way or any objects to hit the patient or the patient to hit any objects. One thing you want to be careful of is putting something in their mouth. It used to be that you could put a bite stick or something in there. However, there's a great chance that they could actually swallow that or get it stuck in their airway and make them stop breathing, cause an airway obstruction. So make sure we don't put anything in the mouth during that time at all. If someone wants to do that, again, just recommend they don't, because oftentimes if they relax their jaw, that bite stick or other object will fall in there in the back of the throat, and then we'll have a whole other problem that's quite a bit more challenging to take care of. And this has been Basic First Aid for treatment of a seizure.